The Congressional Budget Office's review of the House GOP bill finds that over the next decade, the ranks of the uninsured would grow by 23 million people. One part of the bill the CBO tackles are the optional state waivers to Obamacare that would affect people on the so-called non-group market. They're typically there because they're not on an employer-offered health plan. A provision of the House bill allows states to waive two Obamacare requirements. One of them allows states to do away with minimum standards for health plan benefits. In other words, insurers could offer plans that cover less, i.e., pay for less, than they do now. The other waiver option permits states to remove the requirement that insurers charge people with pre-existing conditions the same amount as those who are healthy. There's a caveat to that. Insurers could only charge more if a person fails to maintain continuous coverage. In other words, they can't go on and off of insurance. Under the first waiver, the CBO projects that people who are healthier than average would be able to purchase plans with relatively low premiums. Average premiums for them, it says, would generally be lower than in states that reject this waiver option. Less healthy individuals who have greater medical needs would likely opt for more robust health plans, and as a consequence, the CBO's report says those less healthy people would pay higher premiums for insurance coverage if they could purchase it at all, despite the additional funding that would be available under the House bill to help reduce premiums. As far as the second waiver, the one requiring continuous coverage, health experts say it's not uncommon for lower-income Americans to go on and off of healthcare plans because they sometimes go through periods where they simply can't afford their premiums. That includes those who need insurance most due to their pre-existing conditions.